Good evening, all of you. First of all, it's a great pleasure for me to be here for this presentation on processing of urine. I thank the Prakara Learning platform for bringing the most important category of healthcare society, that is MLTNs, for learning these wonderful sessions. Actually, I am very pleasant to interact with you all by using this session. Actually, the MLTNs are one of the important pillars of this healthcare entire sector. So, as a MLT professional, he or she should know the nook and corners of each and every steps of samples and how the samples are processed from the receiving of the samples till the report, till the interpretation of reports. From this, the entire thing, the MLT professionals should know. So without MLT professionals, MLTNs, the lab sector people, we can't imagine how the healthcare society is running. So each and every process and each and everything they are doing, they always want to be a perfect one. They always very keen to do a very nice procedure. Nice procedure means with clarity they are doing the procedure till the end of the proper result. They will struggle to get. They are working with 100% perfection. And when we are seeing the COVID time and all, the role of MLT people, medical laboratory people, is not at all imaginable. That much work they have done. And till now, so many people are living after the COVID pandemic. That is entirely because of the work of those MLTNs. So this session is really meant for the medical laboratory technology people. So actually, you people are knowing the process of each and every samples, even though. So what all the disease conditions are involved in the background? For one disease means what are all the samples from the basic sample till based on the clinical features, and so different kinds of samples to be collected, tested, and the report is to be made, and it will be interpreted. That is called as pre-analytical, analytical, and post-analytical thing. So these are all the things. If you are knowing only, you can able to process with wide knowledge. So once you are getting the report, it will be a valid one. So definitely the background information is very, very important. So definitely this session will give you mostly the knowledge about the processing of urine. Actually, this is you can think you're all here for learning a new thing. In addition to your knowledge, you can update whatever thing you are already received to update your knowledge. And also, not only the updation of knowledge is important, so you have to disseminate that knowledge to others. So if one patient is coming to a hospital sector, so you should explain to them the way the layman also has to understand. So if he is asking about how the sample has to be collected, and then for what purpose they are telling the sample to be collected, you have to explain very nicely. That is also one of the responsibility of a medical laboratory technologist, because if the sample is not properly collected, so your work will be double. So that knowledge definitely you people have to get. So this entire session, which will give you more update on the processing of actually the urine sample is one of the important sample. Different types of disorders and diseases can be diagnosed with the help of this sample, that is urine sample. So you will get more idea about on different kinds of physical examination, different types of examinations are there. So not only that physical, chemical, microbiological examination, different types of examinations are there. So you will get to know about, at the end of the session, definitely you people will have more idea about the urine sample processing. Through that, you can able to be update your knowledge, and also that updation, definitely it will be very helpful for your future endeavors also, for getting nice opportunities in different kinds of labs. Because not only one lab which makes the use of one sample. So all the laboratories are using this sample for the examination of pathogens and also different types of abnormalities. So we can move into the session. So processing of urine. So myself, Dr. Bharati, I am the Associate Professor of Microbiology. So when urine analysis is done, why we have to do this analysis? For general evaluation of health and diagnosis of diseases and disorders of the kidney and urinary tract and other systemic diseases diagnosis also we can do with the help of this analysis, and monitoring the patients with diabetes and to screen for drug abuse. These are all the things. These things make urine to be processed. So urine analysis, it is nothing but an array of tests performed on urine. And one of the most common, it is one of the important and common method of medical diagnosis. So before we go into examination, different types of examination, we should know what are the factors that are involved. Pre-analytical, analytical, and post-analytical factors. Once the physician is seeing the patient, so he will prescribe some test for him. So especially he has to collect based on his clinical feature. He is telling the patient to collect urine sample. So first he has to go for requisition of sample, requisition of what are all the tests to be performed, and the patient test to be prepared. Then sample collection test to be made. Then the sample is to be properly handled, and it should be transported in a that is healthy manner, that is hygienic condition. It has to be transported, and the specimen is to be received in the laboratory. Till this, pre-analytical factors are coming. Second one is analytical factors. The performance of all the tests in a laboratory, that is called as analytical factor. And post-analytical factor means once the tests are done, the results are revealed. And results are based on the results, reports are made. And using the report, the interpretation is done. So these are all the things that are called as post-analytical factors. Next. There are two important examinations we can do for urine sample. One is if it is going to microbiology laboratory, we have to do microbiological examination, and biochemical parameters to be identified means biochemical laboratory it will go. First, we are going to see about microbiological examination of urine sample. So first, before that, one of the important and critical problem now the world, especially the females, are facing is urinary tract infection. So what are the types of UTI? Upper and lower UTI. Pyelonephritis, where the renal pelvis is involved, and lower UTI, which has three important types: urethritis, cystitis, and prostatitis. And recurrent UTI is that definitely the person undergo various analysis in microbiological laboratory. So what are all the symptoms of UTI? Okay, not only a single symptom, but also various features are involved. Strong and persistent urge to urinate, a burning sensation when urination is there, and frequent small amounts of urination, and urine which appears cloudy and also which is showing different colors, red, bright pink, or cola color. Urinous means these are all the symptoms the UTI is creating. Next, for what are all the conditions which make the UTI, that is UTI, to be developed? What are all the risk factors? Urinary tract abnormality is there, means, and blockage of urinary tract is there, and the person is having suppressed immune system. And for women, the common reason is shorter urethra. And if any urinary procedure or surgery is made, that also the important risk factor of UTI. So diagnosis of urinary tract infection, semi-quantitative, is done by two important methods. First, they can go for semi-quantitative culture method. After culture methods, once the organism is revealed, we have to do antimicrobial susceptibility testing of the potential pathogen and which are present in significant numbers. And the most important thing you should know about the types of urine samples: the random sample, morning sample, clean catch, midstream, 24 hours, postprandial, suprapubic, aspired urine samples. The random sample here, the purpose also it is that random sample, it is for routine screening and full urine examination, that is FEME means full urine examination and microscopic examination. That is random sample which can be collected anytime. Morning sample, definitely we have to stick on to the morning time. First urine has to be collected. For pregnancy or any microscopic test, we have to collect morning sample. And clean catch midstream, we have to discard the few first drops of urine and we have to collect the remaining bit. And definitely it is to be for culture. 24 hours, all the urine passed in the first day and night, and the next day, first sample also to be collected. This is called as 24-hour sample. It is used for the quantitative and qualitative analysis of substances which is present in the urine. Postprandial is for checking the blood glucose, urine glucose level, which is collected 2 hours after the meal. Suprapubic aspired, it is done by needle aspiration. And to obtain a sterile urine, we are doing suprapubic aspiration. In addition to that, Foley's catheter also we can use when the urine is not, we won't be able to collect urine from the bedridden patients, from the hospitalized patient, we can collect by using the Foley's catheter. It should be a sterile one. Next one is suprapubic aspirate. This suprapubic aspirate we can use for collecting the urine sample from the infants. It's very difficult to collect urine sample from the infants, so we have to use fine needle aspiration, that is called as suprapubic aspiration. The next one is cystoscopy specimen. So if we want to avoid urethral contamination, so the urine is collected from the bladder itself, so it is called as cystoscopy specimen. So this is also one of the important things. So what are all the criteria which made the urine to be rejected? What are all the things are involved? If the urine sample is collected, it is a bit pan urine, and if it is collected in a non-sterile container, not a recommended container, and bag urine also, which is stagnant, which supports the growth of so many microorganisms, so that also should not be used. And unlabeled, improperly labeled specimens also we should not use. And if the urine is collected in a leaked container, we should not use that urine. So these are all the rejection criteria. And patient sample documentation. Dear students, and this is the app Prakara. And then if you want to know more, if you want to attend more webinars, and then they are really come up with so many series of webinars with very, very nice topics, you can subscribe Prakara. Okay, thank you. Then patient sample documentation, it is also very much important. So what are all the things to be there in the documentation? One is patient name, then UHID number is very, very important. That is nothing but unique hospital identification number. For each patient, one number is allotted. That UHID number is very, very mandatory for each and every sample. Lab number is very important, and test requested. What are all the tests the doctor is requesting? That also has to be marked. These are all the important things in documentation. And what are all the process to be done in microbiology laboratory? Once we are collecting the urine has to go for gram staining procedure. So as you are MLT student, most of you people are knowing about gram staining technique. So it is a staining technique which is differentiate gram positive and gram negative bacteria. We can able to find out very easily based on the gram reaction. These organisms which are there in the urine. And next second method is rapid urine culture. So for this, we have to take 500 ml of ml of uncentrifuged urine, which is added into the media in the Euroquattro machine. Okay, I'll show in the next picture. So in that machine, one media, that is eugonic media, is there. In that, the urine has to be added. The processing time for this rapid urine culture is 5 hours. After that, we will get a report. This instrument is not only used for analysis of urine, but also for sterile or non-sterile fluids and other biological samples, and enrichment of isolated colonies also it is used. And this uses the patented technology based on the light scattering, which is able to detect the presence of bacteria, and also not only the presence of bacteria, but also their drug resistance we can able to find out. This is the Euroquattro machine where the urine sample is processed. So here the second picture, the yellow line, which is the control line, whereas the red line which is showing the peak, which is going to the peak means some growth of the microorganism which is there in the urine, which is having the meaning of some culture, that is some microorganism which is present in the urine. Next one is what all the media is used for doing cultivation of microorganism from urine. One is sheep blood agar, well-dried sheep blood agar, McConkey agar we can use, and also the brain heart infusion agar we can use. So this is the process of urine culture. We have to take 10 ml of urine sample, and the second picture to the media we have to do first the loop is touched into the loop containing urine sample is touched at the center of the plate, from which the inoculum is spread in a line across the diameter of the plate. Then the loop is drawn across the entire plate, which we have to do crisscross streaking to isolate the colonies. And one of the important thing is we should not heating in between the streaking mechanism. So whichever plates we have done the inoculation, it has to be, if it is a blood agar plate, means we have to go for 18 to 24 hours incubation. And McConkey agar means we have to go for overnight incubation at 37 degrees Celsius. For suprapubic specimens, any number of microorganisms, it is grown, we can take it as significant growth. Under good elimination, we have to read the number of colonies. with a good light cover, we have to analyze what all the colonies are there in the plate. Next one is how to know whether it is significant or not. First, the culture has to be read. Under good elimination, I already told you, and multiply the number of colonies by 100 to get the microorganism, that is bacterial species per ml. The results are correlated with the gram stain picture of the urine. We have already done the gram staining. So based on the results of gram staining, we can just compare the result based on. So why I am telling, if gram staining, it shows the different types of colonies, whether it is gram negative bacilli and gram positive bacilli means, definitely the culture also shows, the plate also shows two different types of colonies. So we have to correlate, we should correlate the results of plating and also the gram staining. Next, the important thing, once the organism is revealed, it's not the ending point. We have to go for antimicrobial susceptibility testing. By using some reference strain, we are actually doing the antimicrobial susceptibility testing, and we are giving results like sensitive, intermediate, and resistant form. Actually, the zone of inhibition, if it is very small, it is a sensitive, it is an intermediate sensitivity. If the zone of inhibition it is large, one we can say that is a highly sensitive organism. And if there is no zone which is formed in the plate, that is called as resistant species. We should not suggest that particular drug for the organism. So this, then we have to go for, actually for antimicrobial susceptibility testing, we have to do with series of drugs which will be react with the isolated organism. Then quality checking, we can use ATCC cultures, American type culture collection strains we can use. So reports, how we can reveal the reports, if it is growth, mixture of more than 3 types of organism, if it is there in the media, it is revealed as improperly collected specimen. The culture result should not show like that. Insignificant, and then insignificant, also improperly collected specimen, the result is revealed like that. So it is called as insignificant result. When growth shows 1 to 2 types of organism with more than 1 lakh colonies per ml means, you can report as greater than 1 lakh colony forming units, CFU per ml. It is the significant result. If it is, if you are having somewhat doubtful significance after 24 hours of incubation, if mixed growth is there, it is called as doubtful. Since Candida, which is in urine, is actually a colonizer of urinary tract, repeated test to be done to confirm the organism. And then Pseudomonas species also, if it is growing, so you have to do for repeat culture. And culture shows more than 3 types of organism after 24 hours. Definitely. Why I am telling this thing again is, you have to repeat the processing till you are getting the proper result. This is the picture shows the growth of the colonies in the media. The first one is nothing but McConkie agar. So lactose fermenting colonies and non-lactose fermenting colonies we can easily differentiate by using McConkie agar media. And then the next one is the blood agar plate. We can easily measure the hemolytic organism. We can easily interpret whether it is hemolytic or non-hemolytic by using this blood agar. And the next one is the gram staining result, which is showing the, like this appearance means it is only 1 type of organism. The down is the most prevalent E. coli positive biochemical characterization test. First one is TSI slant, which shows the gas production, and citrate test is the negative one. And indoor motility test also we can do for E. coli. It shows motile and also the indoor positive reaction in the appearance of rendering formation. Next, VP test and then the other LIA test. Okay, these are all the important tests are useful for the identification of E. coli. And you should know the difference between the UTI, how it was arised. That is, from the community if the infection arised, means it is due to the presence of these 5 organisms: E. coli, Proteus species, Pseudomonas species, Streptococcus species, and Staphylococcus epidermidis. If it is arised from nosocomial environment, that is hospital environment, means that is 3 important species are there: E. coli, Klebsiella, and Streptococcus species. This is the way of streaking, it is mentioned here. And as I told already, antimicrobial sensitivity testing, it is showing the zone of inhibition here, different zone of inhibition. It is mentioned. The center is showing resistance, and then the maximum zone of inhibition is the zone of inhibition. The measurement is very high, and sensitive also it is there, intermediate also it is there. It is shown in this picture. And first line agents, what we are using, there are 2 important things: fluoroquinolones and ciprofloxacin. And alternative first line agents, what are all the things we are using is levofloxacin, ceftriaxone, ofloxacin, norfloxacin. And second line agents, trimethoprim, sulfamethoxazole, ampicillin, sulbactam drugs, and amoxicillin, clavulanic acid, piperacillin, tazobactam, and gentamicin. These are all the antimicrobial drugs we are using against urinary tract infections. And next we move on to, is there any doubts? Please, you just write your comments in the comment box, and questions also you can ask. So biochemical analysis of urine. So till now, how the microbiological examinations are done by using culture technique, gram staining, and biochemical reactions. Till the antimicrobial susceptibility testing we have discussed. Then the next thing is biochemical analysis of urine. So not only microbiological analysis, most of the abnormalities which will be detected by using the biochemical parameters. So the basic routine urine analysis, which consists of 4 important parts: specimen evaluation, physical examination, chemical examination, and microscopy of urinary sediment examination. So physical characters means volume, urine volume, color, odor, and specific gravity or comes under physical characters. And chemical analysis means pH, that is hydrogen ion concentration of the urine, negative logarithmic value of hydrogen ion concentration is actually called as pH, glucose, protein, ketone bodies, nitrite, urobilinogen, and bilirubin, and also RBCs. They will be detected by using chemical analysis. And microscopy of sediments, which reveals the presence of RBCs, WBCs, cast, crystals, and epithelial cells. Hope you understood till now. So what are all the indications? Why we have to go for biochemical analysis? So the patient is having urinary tract infection and suspected renal diseases like glomerulonephritis, nephrotic syndrome, pyelonephritis, acute and chronic renal failures are there, and metabolic disorders like diabetes is there, means, and differential diagnosis of jaundice, and plasma cell dyscrasias. Dyscrasias means it is nothing but different abnormalities present in that particular cell, and to diagnose whether the lady is pregnant. For these are all things we have to go for biochemical analysis. So the time of urine collection is very, very important. because improper urine collection may invalidate the result. Okay, the time will be waste. So only I'm telling you people, the MLT peoples, those who are in sample collection, please tell the person how the sample is to be collected. So most of them, they are coming into the hospital, they are not knowing how the sample will be collected. Please instruct them. So it will definitely, based on the instruction you are giving for sample collection, how to collect the sample to the person, definitely as a result, your result will be very good. So improper collection may invalidate the result. So containers should be very clean and wide mouth containers it should be, and it is a dry one. Okay. Single specimen and 24-hour specimen can be collected. The first voided specimen, random and postprandial specimens are single specimens. So I already told the container is very, very important. It should not be reused one, and at least 50 ml capacity has to be collected for the capacity means the container capacity is 50 ml for a routine collection, that is routine procedure, routine test. At least 3 liter has to be collected from a 24-hour sample. So it should be a break resistant and leak proof container. The container should not be reused again and again. So the material of the why means the material of the container should not interfere the quality of the test. So the storage of urine. Storage of urine means actually ideally the specimen should be examined within 2 to 4 hours before after voiding. If delay is expected, if that is not at all possible, because if it is delayed, definitely the result also will be invalid. So the delayed sample, mostly we have to avoid delay of procedure. Okay, once the urine is collected, within a short span of time, it has to go for analysis. If it is not there, if it is unavoidable reasons are there, means it should be refrigerated at 4 to 6 degrees Celsius up to 8 hours we can keep. And when the urine sample is to be preserved, and what are all the things we are using as preservatives? Hydrochloric acid and toluene, boric acid, thymol, and formalin. These are all the different types of preservatives we are using for preserving the urine. Actually, it is not recommended for routine analysis, but 24-hour urine sample, definitely we have to use preservatives. These are all the preservatives we can use. Physical examination, which includes volume, appearance, odor, and specific gravity. So volume means for a normal person, the 24-hour urine output, these are all things, it should be there always in your mind. So whenever it is asked, you should have that is, you should be able to answer, because these are all the important things. Based on this thing also, that is this knowledge also you have to give when the patient is coming. If he is asking any doubt, this thing also to be you can able to clarify. So normal individual 24-hour urine output is 600 to 2000 ml, out of which 400 ml is produced during night time. Okay, according to Todd and Stanford, that standard reference is still 600 to 2000 ml for 24 hours urine output. That is 400 ml is that is released during the night. And increase of urine, why this is happening? The actually 2000 ml for 24 hours, if it is there, that the condition is called as polyuria. 500 ml during night, it is normal. More than 500 ml, more than 2000 ml means that is called polyuria. More than 500 ml during night means that is called as nocturia. Okay. So what are the causes of increase of urination? Diabetes, diabetes insipidus, and chronic renal failure patients and all, the urination is very high. And diuretic therapy and polydipsia, and if the person is taking more caffeine and alcohol, that person also the urine output is more. And decrease in urine, what are all the conditions which leads to the release of reduced urine, which is oliguria. Okay, oliguria, high-grade febrile illness is there, high temperature is there, with acute glomerulonephritis and congestive cardiac failure or dehydration. If the patients are suffering, means definitely they will also their urine formation, their urine output is very less. Anuria, that is acute tubular necrosis, and complete urinary obstruction also, they are the cause of decreased urine production. And appearance, after volume, we have to go for appearance. So appearance means that is nothing but color and clarity. So different types of colors are there. I'll show in picture. So here, colorless or pale yellow means that is a normal urine. Colorless or pale yellow. Dark yellow, which is a concentrated urine. Okay, urine should not be concentrated all the time. So if it is green, means the urine is suspected to have Pseudomonas infection, or it is containing some methylene blue. Yellow green or yellow brown color, it is there. The urine is showing means bilirubin oxidized to biliverdin. This conversion also makes the urine color as yellow green to yellow brown. And red color. Red color is due to the presence of RBCs, hemoglobin, and myoglobin. And the last one is brown to black color, which is due to the methemoglobin presence and the condition alkaptonuria. These are all the things which are making. So these are all the different types of features which changes the color of the urine. Next one is color is lower. Next one is clarity. Clarity, urine should be clear. So whenever we are collecting the urine sample, it should be clear. So if it is turbid, means maybe the pH is raised or pH is reduced. Alkaline means it is due to the precipitation of phosphate, ammonium urate, carbonate, which we can redissolve this urine. Alkaline condition is redissolved on acidification. The acidic urine is condition is due to the precipitation of uric acid and urates, and which is redissolved on warming at 60 degrees Celsius. Then odor. So freshly voided urine, which is of actually typical aromatic odor, which contains. So different types of odors the urine is having based on different conditions. If the patient is having ketonuria, ketones are released in the urine, means it shows fruity. It shows means we can smell like fruit odor. And phenylketonuria condition, which makes the urine odor as mousy. And if the organisms, protease and tyrosinemia, tyrosine amino acids are there, or more in the urine, means it leads to fishy odor. And E. coli infection and old standing urine, which is there, means it creates ammoniacal odor. And foul smell, which is due to commonly urinary tract infection. And maple syrup, rancid, cabbage smell, and sweetie feet and rotten egg, these are all the different types of odors are created because these different causes. So actually, what is the actual odor? This is typical aromatic odor. That is the normal thing. Specific gravity. Next, we move on to specific gravity, which is nothing but relative mass density. So it measures the concentrating and diluting power of the kidney. How much the kidney is diluting the excretory materials as in the form of urine. And concentrating ability of kidney is one of the first function to be lost as a result of tubular damage. So normal range of random specimen, the specific gravity is 1.003 to 1.035. The range of specific gravity for a 24-hour sample in normal adults with adequate fluid intake is 1.015, somewhat increased because it is a 24-hour sample, 1.015 to 1.025. So we can check the specific gravity of the urine sample by two methods. Reagent strip method by using urinometer, which is the most commonly employed method. Very least commonly performed method is falling drop method, that is by using refractometer. Next one is chemical examination. So chemical examination, under chemical examination, what are all the things are there? One is pH. The first one is pH. pH, I already told, it is the scale for measuring acidity or alkalinity. So what are all the methods of pH determination? Reagent strip method, litmus paper test, and pH meter. So the normal pH value of the urine sample is 4.6 to 8. Normal pH is 4.6 to 8. Then by using reagent strip method, the indicators methyl red and bromothymol blue, which gives the range of orange, green, and blue colors. Here we can see the different types of, actually litmus paper method is not mostly used. The acidic urine, alkaline urine, these are all the different causes. Diabetes mellitus, which is due to acidic urine, diabetes mellitus, starvation, fever, UTI by E. coli, and high protein diet or leads to acidic urine. Alkaline urine, which leads, which is because of UTI by urea splitting organism, severe vomiting is there. The people are, the patients are showing alkaline condition, and then the vegetarian diet, which is also the vegetarian diet, citrus fruits are taken more, means alkaline urine formation is there. And chronic renal failure patients also, the alkaline urine is developed. The other methods, litmus paper test, which is not preferably used, and pH meter is, by using pH meter, we can measure the exact pH. So this is reagent strip method, where that is 5, 6, 6.5, 7.0, where we are dipping the urine, that strip which shows the color, and that the measure is that based on the measure, we can find out how much pH the urine is having. This is the actually manual method. Different colors are there. By using the color itself, we can find out the pH easily. And protein in urine, the normal protein level is 150 milligram per 24 hours. Okay. So protein which is having a very low maximal tubular rate of reabsorption, hence the detection of abnormal amount of protein, IMP indicator of renal diseases actually used. So reporting, most methods will detect 5 to 20 milligram of albumin per deciliter. So it is, the results can be read in the plus system as negative, trace, and 1+, 2, 4+. By using this method, we can easily measure the proteins present in the urine. The next one is, what are all the conditions which releases more than 4 grams of protein per day? Nephrotic syndrome, acute glomerulonephritis, chronic glomerulonephritis, diabetic nephropathy, renal amyloidosis, lupus nephritis, and toxemia, which occurs in pregnancy, and end stage of renal disease. These are all the risk factors which leads to the release of more amount of proteins in urine. Next one is, we are moving on to the very important, and the people, wherever we are going in a family, one person is definitely there as a diabetes patient. So the presence of detectable amount of glucose in the urine, which is the condition is called as glycosuria. The glycosuria usually occurs when the blood level is greater than, when the glucose of the blood level is 180 to 200 milligram per deciliter, according to Henry's clinical diagnosis and management by laboratory methods. Management of laboratory methods, 23rd edition. And what are all the causes of glycosuria? Renal glycosuria, which is due to the low renal threshold, which may be acquired or congenital. Example is Fanconi syndrome. And gestational glycosuria, alimentary glycosuria, and consuming high amounts of carbohydrates. This thing is happening. And then the methods of glucose estimation, we can go for reagent strip method and copper reduction method. So normally 50 milligram of disaccharides are excreted in 24 hours. With severe intestinal diseases like SPRU or acute enteritis, this level may rise to 50 milligram or more. So here also it's a reagent strip method is used, which is commonly, it is based on, the principle is based on specific glucose oxidase and peroxidase method. So glucose, when combined with the oxygen, which converts into gluconic acid and hydrogen peroxide. This is the actual mechanical principle. So color changes occurs from blue to brown at 30 seconds, which is by using multi-stick reagent, multi-stick strip, by using potassium iodide chromogen, which occurs in 30 seconds itself. And the manual method, the most common manual method we are using for the determination of glucose is Benedict's method. 5 ml of Benedict's reagent added with 8 drops of, that is 0.5 ml of urine. So the color indicates negative, means negative control we have to definitely employ for comparing the urine sample. So if it is more than 2 grams per deciliter, shows red color, which is a 4+1. And then 3+, which shows 1.5 to 2 gram per deciliter. And 1 to 1.5 grams per deciliter is a double plus. And single plus, which is 1 gram per deciliter, 1 gram of glucose per deciliter. Then second one is ketones in the urine. Ketones in the urine, the condition is called as ketonuria. 3 ketone bodies are present in the urine: acetoacetic acid, acetone, and 3-hydroxybutyrate. So what is the test used for the detection of ketone bodies in the urine? Rothra's test. The Rothra's powder is mixed with ammonium hydroxide, which forms the purple color ring. If it is purple color ring is formed, means the ketone bodies are present. The ketone bodies are negative, means the ketone bodies are not there in the urine, as there is no purple colored ring is formed. So reagent strip method also the same method. It is less sensitive to acetone, and then it contains buffers and sodium nitroglyceride. So what is the actual sensitivity here? Means 10 milligram per deciliter of acetoacetic acid and 70 milligram per deciliter of acetone. Determination of bilirubin. It is actually, bilirubin is a breakdown product of hemoglobin. The normal adult urine has only 0.02 milligram per deciliter of bilirubin. The increased urine bilirubin, which occurs in obstruction to bile outflow from the liver, and hepatocellular disease with decreased excretion of conjugated bilirubin in bile. So presence of bilirubin in urine means presence of only conjugated bilirubin. This thing you should know. Presence of bilirubin in urine. What is the actual meaning? Conjugated bilirubin, if it is present, that is called the presence of bilirubin. So you can go for Ehrlich test result. Urine plus Ehrlich reagent we have to add. If it is showing pink color, it is a normal urobilinogen. Pink to red color is high urobilinogen is present because of the conditions hepatic jaundice and hepatitis. So students, dear audience, you are listening to the most important session of sample collection, that is urine sample collection. Actually, this session, the Prakara Learning platform is doing. So kindly, if you want to go for more sessions, if you want to have interact with many people, and if you want to enjoy different types of webinar sessions, you can subscribe Prakara. Then bile salts and bile pigments, by using hair sulfur powder test, we can do bile salt determination. Bile pigment determination by using Foucher test. Determination of urobilinogen, and there are three important that is urobilinogens are there. Actually, the conjugated bilirubin which reaches to duodenum without getting absorbed and passes on to colon, where it is ingested upon by bacteria to form urobilinogen, mesobilirubinogen, and stercobilinogen. Out of these, small amount of urobilinogen is excreted in the urine after the intrahepatic circulation was complete. Normal output of urobilinogen in the urine is 0.5 to 2.5 milligram per 24 hours. So what is the urobilinogen output? 0.5 to 2.5 milligram per 24 hours. This is this thing, urobilinogen determination. We can go for reagent strip method, diazotablet test method, and wash through tablet method. So here the tablet tests are confirmatory test for determination of the urobilinogen. So why, what are all the risk factors and what are all the things which leads to more amount of urobilinogen excretion? Hepatocellular damage, congestive heart failure, and infections such as cholangitis and hemolysis. These are all the things which means the excretion of more amount of urobilinogen in the urine. And nitrates. Nitrates, if it is detected, means definitely mostly the infection occurs with E. coli. Culture, E. coli, 93% of agreement with cultures which shown positive for E. coli, and detect 70% of positive results when compared to the cultures. Okay, so nitrite is mostly due to the infection of E. coli. In addition to the E. coli, other organisms also, if it is present, the nitrate level in the urine is so high. Klebsiella, Enterobacter, Proteus, Staphylococcus, and Pseudomonas. These are all the organisms also which makes nitrates in urine sample. It will go at elevated level. So it will be detected by using reagent strip method. So basically, based on the conversion of nitrate to nitrite by the action of bacteria, it will be there. So nitrite plus P-arsenic acid, when acidic pH is maintained, it converts that into diazonium complex. Okay, this indicates 10 power 5 or more organisms per ml of urine itself, which contain 10 power 5 or more organisms. So bacteria in the urine, which is actually called as bacteriuria, which is more than 1 lakh bacteria per ml of urine, is that means the nitrate level is going elevated level. So the method detects the presence of 0.075 gram of nitrates. If it is present also in the urine, we can go for this nitrite test. And then leukocyte esterase, it is a marker of human neutrophils. The positive leukocyte esterase, significant number of neutrophils, either which is intact or lysed, that is called as positive leukocyte esterase. It has a high negative predictive value. Because of the neutrophils and other cells are labile in the urine, this esterase, leukocyte esterase activity, it acts as an indicative of remnants of cells, that is those cells which will not be seen microscopically. So here also we can go for reagent strip method. So leukocytes negative to positive value, which is shown here. So trace is 15 cells per mule, and then 70, 125 is somewhat near than high level, and large 500 cells are there per ml, means definitely it is the condition we have to go for. Definitely we have to go for treatment process. And hematuria, what does hematuria means? The presence of increased number of RBCs in the urine, which is called as hematuria. So this microscopic hematuria, 3 or less greater than or 3 RBCs, which is there in one field. So hematuria can be detected, can be confirmed through microscopic culture. And this albumin to creatinine ratio, which includes that is albumin to creatinine ratio, also can be detected. American Diabetes Association stated a preference for the albumin to creatinine ratio, that is ACR, less than 3 milligram per millimole is normal, and 3 to 330 milligram per millimole is molecular weight is moderately increased, and greater than 30 is severely increased. So regard the confirmed ACR of 3 milligram or more, it is a clinically important proteinuria. If the urine ratio, if the urine is contained the ACR level of greater than 70 mg, there is no need to repeat the repeat. We can confirm the result if the result is showing greater than 70 moles. So these are all the important other special tests of urine. Porphyrins we have to go for. Watson's quartz test is used for the determination of porphyrins. They are the group of diseases resulting from the defects in the synthesis of heme. That is so only it is called as one of the special tests. And there is melanuria. There is no specific test is done. Which non-specific color reactions, if it is produced based on Ehrlich aldehyde reagent and nitroferrocyanate, is that a column cation exchange chromatography method we can do for the detection of this melanin metabolites, which is present in the urine. 5-hydroxy indole acetic acid, it is a metabolite of serotonin, which will be detected by using high performance liquid chromatography, that is HPLC. And Windston proteins also we can detect, that is actually associated with multiple myeloma, macroglobulinemia, and malignant lymphoma. Electrophoresis and immunofixation electrophoresis are done to detect the Windston proteins. And microalbuminuria, the range is 20 to 200 milligram per liter, according to Todd and Stanford standard reference, which is very important for monitoring early diabetic nephropathy. Other than this, so many different types of tests which are there to determine phenylketonuria, alkaptonuria. These are all the important things. So microscopic crystals has to be determined. It's very important. So microscopic examination of urine. If we are doing microscopic examination of the sediment part of urine, we can get the result of different types of cells: RBC, WBC, mucus, various epithelial cells, various crystal, and bacteria and cast. These are all the different epithelial cells we can find out in urine. And microscopic examination, which will reveal the presence of hyaline cast, granular, RBC cast, and WBC cast. So have a look on it, all the cast. And these are all the different cast material. Casts are present, how the appearance is, and main clinical association. So these are the various important casts are observed, and it is revealed once the sediment of urine is analyzed. through microscopically. Okay. So crystals, common crystals, these are the common crystals which are present. And the most frequent appearance also it is given: uric acid, amorphous urates, monohydrated calcium oxalate, calcium phosphate, triple phosphate, and amorphous phosphate. These are all the important crystals also we can find out through microscopically. And normal crystals, the above things are the normal crystal: uric acid, calcium oxalate, hippurate, calcium phosphate, triple phosphate, calcium carbonate, ammonium biurate. And abnormal crystals of the urine, as they are bilirubin, cholesterol. Actually, it should not be there in the urine. If it is detected in urine in very few numbers, also definitely it has to be detected properly, and they have to go for the proper analysis and treatment. Cystine, leucine, engineer, acyclovir, sulfur, and tyrosine. These are all the abnormal crystals. Pathological crystals are cholesterol, cysteine, and 2,8-dihydroxyadenine. Main crystals caused by drugs: sulfadiazine, acyclovir, engineer, and pyridoxalate, primodin, and felbamate. These are all the main crystals caused by drugs. Once the people have started to have drugs, the crystals are formed and it is excreted in the urine. So based on what all the medications they are having, those tablets which will form an insoluble crystal-like, which is released in the urine. Abnormal urine shows the presence of, already I told, uric acid, cystine. This is a clear picture, shows the cholesterol, sulfadiazine, engineer, tyrosine. These are all the abnormal urine crystals. Urine containing abnormal crystals. Okay, thank you all for a very pleasant listening. Definitely, I'm thankful to you. And if any queries are there related to the urine examination, processing of urine, microscopic and microbiological score processing and biochemical processing, please just put it in comment box. So thank you. Any question is there, you can share. So I hope you all just understood something from this session. If you want to know and join into a series of webinars by eminent people, and you want to learn different types of diagnostic tests, you can very well join in the WhatsApp group, and then you are all invited for the subsequent webinars. Now I invite Mr. Amir from Prakara for sharing few things related to the learning platform. Prakara.
Firstly,
Yes, sir.
thank you so much, ma'am. Thank you so much, and a very warm evening to all the students who have joined this session across India. So, firstly, just let me just define what is Prakara Learning. So, Prakara Learning is exclusive of paramedical edutech platform, wherein MLT is one of the specific things that we exactly teach online. What we exactly feel is like the technicians who are exactly present in the laboratories, they can only do well if their fundamentals and if their knowledge driven tasks which they are exactly having is up to mark. So we carry this basic vision of keeping their fundamentals strong, parallelly focusing on their laboratories. So to make that, we completely understand students are working hard, students are learning hard. But as from Prakara, to those students who exactly wanted to taste the flavor of what is Prakara learning, we would like to introduce one small campaign which is called as MLT. MLT, and this is a program which is for Bachelor of Sciences of MLT, wherein there is a small pack which is just for rupees 149. We don't even get a pizza for 149 rupees. So it is a mini learning program that we are exactly doing, in which the complete year syllabus would be coming in the form of video lectures by the subject matter experts, student notes wherein students can understand what the subject matter experts are exactly telling, and they need not write the notes separately. They will be having the student notes inside the application, and of course the key terms which would be giving a clarity in terms of what is it in terms of the scientific naming, yeah, scientific definition of a specific term which they would be having in their syllabi. And after completing all this, a student should have their self assessment test ready. So we at Prakara also build this self assessment tool to not only give a student a baseline of learning, but also to make the students understand how well he or she has learned the subject. And we are having this for first year, second year, and third year. Of course, if any student wants this, they can fill the form which is being posted on the YouTube chat, or else can just reply on our WhatsApp group, such that we would be calling and we would be explaining you this complete affinity accordingly. So this is just for rupees 149, and this is valid for 21 long days, wherein you can utilize the complete year's syllabus. So this is the basic privileged pack that we have launched from Prakara Learning. I expect the students who have exactly joined would also be telling this to their friends and making them understand about things. And whoever has exactly joined in this webinar, I firstly congratulate them for the participation, and I expect that people will not sleep with empty minded. People have something exciting that they have learned today, and they would be sleeping with that basic satisfaction. So students always, learning is what exactly makes us grow, and I appreciate your participation. All the best for the endeavors, and if there is anything related to doubts, I would request all of you to please join Prakara Learning WhatsApp group, which is for MLT exclusively, and we would be there to solve your questions. So thank you so much for having us. Yeah. uh, So if anybody is having any doubt, they can post in the chat box. We are there to answer your questions, students. Yeah, ma'am, we'll just wait for 10 more minutes. If students are posting the
Yes,
doubts, we'll
yes,
just
no
carry
problem, sir.
forward. Yeah?
No issue.
Yes, ma'am. Yeah.
Yes, students, any doubts if you are having, please put it in the chat box. Okay, so I hope you all understood the concept well. So we believe you definitely you will get benefit from this app. You can very well join, as Amit sir said, you can very well join and get you benefited. Okay, thank you all for this, for uh, for being uh, as a listeners. Thank you all. Thank you for your active participation. Thank you. Thank you, Linda. Thank you.
Yes, ma'am. Ma'am, I've stopped the live stream.